Pellegrino here. I'm a licensed acupuncturist with Raja Wellness, and I'm going to take you through in this video what to expect when you come in for one of our allergy treatments using Dr. Solomon's auricular allergy treatment. This is a technique that I learned from Dr. Solomon, and it's very effective. I would say that 95% of the people that we use this treatment method for have significant reduction in their allergy symptoms as a result of this treatment. It is a one-time treatment. We typically don't have to do multiple treatments for the same allergy. Occasionally with the alpha-gal tick-borne allergies, sometimes it does take more than one round of treatment to eliminate the allergy. But once it's put into remission, it tends to stay there. Even if there are subsequent tick bites, we don't tend to see a reactivation of that particular allergy. So when you come in, we'll review the list of substances that you have known allergies to, and we will use what we call filters that are these little glass vials, and they have an electromagnetic signature embedded in the liquid in them. And that allows us to verify the allergy using applied kinesiology. So if you've never seen this before, it's sometimes called muscle testing. It gets a bad rap in the Western medical world because it's hard to explain unless you're using physics. But I have found it to be very effective and very accurate. And so what we do, I like to use the deltoid muscle when I do this, and we'll check and see how strong that deltoid muscle is with nothing, and then we'll add the input of the signature of that filter via a bowl, so there's no actual direct contact with either the filter or the substance in your body. And then we'll see, do you stay strong or do you get weak? And if you get weak, then that is most likely an allergy, and I have a way to verify that. Once we identify the allergens that we'll be treating, we use that same method to make the point in your ear light up. So we actually have to have a sample of the substance and then, or the filter to stand in for that sample. And when it's in contact with your body, that will make a point in your ear electrically active. And I have this handy dandy little probe here that helps me to identify where that electrically active point is. And when we find it, and this will happen with any acupuncture point in the body. Let's see if I can find one here on myself. It'll make a buzzing noise. I don't know if you can hear that, but it makes a buzzing or a clicking noise. So once we find that in the ear, we place what I call a marker needle. And this is a needle that will not stay in. We just need to be sure that we're in exactly the right spot. We'll verify that the muscle then stays strong. And then I'll mark the point with a surgical marker, and then we'll go back and place in the needle that will actually stay in, which is a very small intradermal needle. And we'll repeat this for each of the substances that we're treating. Now, let's say that you are coming in for an allergy to dogs or cats or horses. If you have animals, then it will be most effective to actually have you bring in a small sample of your animal's hair and dander. And the best way to do this is to brush them and then scrape some of the contents of the brush into a plastic bag or a little mason jar and bring it in with you to your appointment. If not, we do have generic filters for all of those, but the more specific we can be to the animal, the more effective the relief is likely to be. After we get the needles placed in, we'll put a surgical adhesive over the top with some little bandages, and we'll give you some ear covers that you can use for when you're showering to help keep the water out of the ear. But basically at that point you want to leave those alone, keep it as dry as possible. The big thing to remember is there should be no pain. So if there's any pain, redness, swelling, and you didn't accidentally bang your ear or sleep on that side, then I want you to remove the bandages, have somebody help you make sure all the needles are out, clean it very well, and then call us. We will happily replace the needles at no charge. We don't need anybody trying to push through discomfort and getting an infection in their ear. This is definitely not something where more pain, more gain applies. So once the needles are in, we'll give you a list of the things that we're treating you for. And particularly with food sensitivities and allergies, it's really important that you avoid those foods for the duration of the time that the needles are in. So even if it's a relatively mild allergy and it's something that you've been eating and just powering through the discomfort, we still want you to avoid that food while the needles are in. Part of this is so that your body can calm down that allergic response, and it helps allow the needles to work better. The other reason is that when the needles are in, there is a possibility of a more severe reaction, and we just don't want to risk that with intentional exposure to these foods. Now, the most common thing that we do this for is alpha-gal. And alpha-gal is a little bit of an oddball, even from Western medical terms, because it doesn't follow any of the normal rules. It doesn't matter what your IgE levels are. It has no correlation to the severity of the reactions. The alpha-gal carbohydrate is found in mammal, so it'll be in beef and pork and venison and lamb and rabbit, and even dairy. So it's important to avoid anything that has fur on it. If you're eating fish or chicken or anything that comes with feathers or scales, those are going to be completely fine. The other thing that tends to crop up with alpha-gal is a lot of people will develop a wheat sensitivity that they didn't used to have before alpha-gal. So that's also something that we check for everybody who comes in for treatment for that particular allergen. Similarly, let's say you're coming in for a latex allergy. Bananas can be a cross-allergen to latex, so we'll check for both of those when you're here. If you're coming in for something that is a unique sensitivity, call us ahead of time. We may need to order a specific filter or identify a source for that substance so that we can use it during the treatment. The other thing that you need to let us know is if you have a known sensitivity to metals, like a nickel allergy. We do use surgical stainless steel in these needles, but if you have a history of metal allergies, there may be some additional steps that we have you take prior to actually placing the needles. Similarly, if adhesives cause a lot of reactions and you can't wear band-aids and you can't wear athletic tape, we may consider doing some additional steps before the actual appointment to place your needles to help minimize any potential negative reaction once the needles are in for treatment. So hopefully this helps to answer your questions. We look forward to seeing you here in the office, and if you have a question I didn't cover in this video, please give us a call and let us know. But we just want to help you be a little bit more prepared, and since we are trying to be compliant with the requirements for social distancing, we're trying to do as much of the communication in advance of the appointment as we can to minimize the amount of face-to-face contact while you're here in the office. So I appreciate your patience with these additional measures that we are taking, and again, if you have any questions, please let us know. We also have some frequently asked questions about this on our website.